The ironic thing is he came into my room 4 days ago after I had a violent coughing fit and asked if there's anything that I can do to make it better. Anything I can do to make it better. You know what can be done to make it better? Stop stressing me the fuck out. And what does he do the day after, the very next day after showing concern? He starts another fight. Performative concern. It's not upsetting him that I'm coughing. It's upsetting him that he has to listen to it. He knew what my conditions were before I moved in. He knew what the symptoms are before I moved in. Is there anything I can do? He knows damn well I've been researching the heck out of my diagnoses and what the current preferred treatments are. He knows I've been blacklisted from medical care. He knows that I research those preferred treatments that I cannot prescribe to myself and look for over-the-counter and natural remedies that are comparable to try to make things better and keep things from getting worse. So for him to come in here and ask me after watching me for 2 years research the fuck out of my diagnoses, and I continue my research because there's always new scientific breakthroughs, medical breakthroughs. So it wasn't about me finding ways to help myself. It was about me finding a way to shut myself up so he won't be uncomfortable. You know what his suggestions were? Mucinex. And he knows that I only used the Mucinex because it has a side effect of sedation. And I was having nightmares. I still have nightmares. I was trying to stay asleep. But Mucinex is counterintuitive for bronchiectasis. Mucinex is an expectorant. Bronchiectasis is a condition where the bronchial tubes are dilated, and so the expectorant would be great if I didn't have bronchiectasis that causes problems in clearing the mucus. The expectorant breaks it up to make it easier to clear, but if I have trouble clearing it in the first place, then that is going to be really dangerous for me. I just tried the Mucinex to see if I could get the sleep benefit, and it didn't work. It just made the nightmares worse. So I quit after taking 1.5 pills. One pill the first day, a half a pill the second day, and it was not good. It made the pulmonary issues worse and made the nightmares worse. The other suggestion he had was, how about steam? I have a fungal colonization of my lungs, and he knows it. Steam would make my lungs even more habitable for the reproduction and proliferation of the fusarium. And he knows this. I was sharing all of my research with him. But he can't remember anything because it doesn't affect him personally. He just brings his complaints to me when it does annoy him personally. I am doing the best I can to save an emergency escape plan fund to get the fuck out of here, to go to a different state where I can access functional medicine at a lower cost. I'm waiting for the day I turn 65 so I can switch from Medicare Part C with its gatekeeping and go to straight Medicare with a Medigap plan, so I have more accessibility to doctors and services. I've got 9 months to wait on that ability to change to Medicare, straight Medicare. So I am doing everything I can to help myself. Once your medical conditions are so complex that they can start citing cost effectiveness calculations to deprioritize your care, that's when shit goes downhill. And once you receive a formal dismissal letter like I did, I received a formal dismissal letter from the entire KU Physicians Network immediately after I was diagnosed with the Fusarium colonization in my pulmonary fibrosis, bronchiectasis, riddled lungs. That shit follows you across state lines. That was in Kansas. I'm now in the Las Vegas metro area. And since I moved, I got the dismissal letter in November of 2021 and tried to reestablish a healthcare team there and was unable to. And I moved here in March of 2023, and I have been to multiple appointments with PCPs, primary care physicians. I haven't been to. I've been scheduling them, and either they tell me to reschedule if you have upper respiratory symptoms, or they do see me, and then they falsify the visit notes. And then I complain to insurance, the Part C provider, and they side with the doctor saying that they made the best assessment they could in the time allotted, the 15 minutes allotted. No diagnostic testing. Just talk to me for 50 minutes. Don't even look at or touch my body. And then write all kinds of stuff in my chart that's not even verified. So yeah, I took my health into my own hands because I cannot access the care. I've been deemed too cost inefficient, and because I advocate for my care, now I've been deemed too difficult. He knows this burden that's on me. He's been in some of those intake appointments, in the exam room as a witness, and they pay more attention to him as my caregiver than me. Oh, and yes, Adult Protective Services did come out here. The therapist I had a few months back in, it came out back in February, based on a report by my therapist, and they saw the apartment, they saw the hoarderness, they saw the tight pads that my wheelchair can't fit through. They saw my food up on the uppermost shelf. And all they did was hand me a resource list. The same old, tired resource list that's worthless. I am a vested, retired Health and Human Services Agency employee. I know where the resources are. I know how to wade through the bureaucracy and red tape. The help is not there. I spent my career helping people, pointing them to the resources. And for some reason, to this day, providers are citing COVID as a reason why they're tapped out. To this day, they're still blaming COVID. I've called Catholic Charities, I've called Jewish services, I've called patient advocacy groups. I've gone up the chain from Medicare Part C insurance providers, healthcare group network, Medicare, CMS, Office of the Inspector General, elected officials, Adult Protective Services, battered women's shelters, but psychological abuse doesn't warrant a bed, and they don't board the cats. I'm not leaving my cats behind because he's already kicked one of them. I've contacted law firms. That's not in our wheelhouse, they say. Translation, We're not going to fight an insurance company or a hospital legal team when you're on SSDI. I've even contacted the news media, and all I get is crickets. I've contacted print and TV news media. Crickets. Nobody cares. So here's my advice to everyone who is still young. Save for your golden years. The dream of the golden years is tarnished. There is no safety net. Do not rely on Medicare or Social Security or community services or your family for that matter. Start saving now, because no one's going to save you. No one's going to protect you. We are the discarded elderly. I'm not the only person this stuff is happening to. That's the sad part.